Okay, we are doing the last video for chapter 16, nursing management in postpartum.
All right. So this book really likes to end with nursing management. I feel like we talk about this stuff a lot all throughout the chapter before. When we talk about maternal adaptations, and then we talk about nursing care. And this just goes into a little bit more specific of it, but I'm going to go through it quickly because we kind of have already talked about it. But I will take a minute to talk about optimal cultural care. There's a box in your book that kind of breaks down the cultural influences depending on the cultural background that they come from. I have such a conflicted relationship with these boxes. It just seems to me so not culturally competent to put cultures in a bullet point list. But I can appreciate and I do understand that like this helps to people be slightly more aware of maybe something that a culture may believe, but it's really not an individual approach. So cultural awareness, I kind of like cultural awareness more than like cultural competent, because I can guarantee you that I'm never going to be cultural competent about anyone's culture, even my own, right? Because everyone handles it so individually and what's important to them and what they choose to pull from the culture and what they choose not to pull from their culture. So cultural awareness is raising people's understanding of the influence of culture on our lives, of how we do things, of how we communicate, of what foods we eat, or even how we go, like our work ethic and how we work. So being culturally aware means understanding why cultural diversity is important and recognizing that not every person will do the things in the same manner that we do. Being mindful of this diversity allows us to be more respectful of others and the way that they operate and based on their cultural backgrounds. So you might not be totally familiar with other cultures, but if at least you're willing to understand your own culture and how it affects you, then maybe you can take the step in developing a sense of cultural awareness around other cultures and how it could influence them, right? So that's kind of my thing on cultural is, we're raised to think because we did it this way, everyone should do it this way. It works for us. It will work for everyone. But that's not the case at all, right? So we really just have to base off of people's experiences in life and the different opportunities that they've had and then how culture influences them. So another thing, thanks for letting me go off on my little soapbox there. So one of our interventions then would provide comfort. We do hot and cold. We do ice that first 24 hours on the perineum. Some people will do a sitz bath after 24 hours, or even a warm pad and warm water down to the perineum. We have those lidocaine sprays. We have the witch hazel or the Tux pads that are topical preparations that can help promote comfort. And then we have analgesics, anti-inflammatory drugs such as NSAIDs like ibuprofen and naproxen can help relieve some mild postpartum pain. For C-sections, people are prescribed narcotics. Most vag deliveries won't be prescribed narcotics unless it was a really traumatic vaginal delivery. We assist with voiding and bowel elimination, which we've talked about a lot. We promote activity, rest, and exercise to the best of their abilities. I can't say enough about the importance of early ambulation. This is for everyone, anybody who's had any kind of surgery or illness. We really want most of our people to get up and to be walking, especially our C-section clients. When they don't want to walk, it just makes me so sad for them because I know the recovery is going to be so much harder. So for me, I call it assertive caring. It's really not an option. These girls are going to be getting up and they're going to be walking. I mean, I'm not that mean, but for the greater majority, I don't think it's very kind to let them stay in bed. So I think it's more kind to promote recovery and promote healing. And so we get them up early and we get them walking, even if it's just standing up or a little walk to the bathroom and back. Any kind of early ambulation will reduce the risk of blood clots. It promotes blood flow, which will promote healing. It reduces constipation. So I'm a big fan. Rest periods, it's important that they're napping when they can, that they're trying to reduce all the outside activities, outside participation, that they're trying to get their rest whenever they can. This is a really hard thing to do, especially if you have other kids at home, but just promoting more or less just not putting the pressure on yourself to do everything anymore, to recognize that these first few months are a recovery period and that you don't have to resume life as normal, that you just let your body rest and kind of remove all expectations for yourself, kind of not worry about Instagram and what the world thinks about you, but just rest. An exercise program, especially Kegel exercises, we want to get that pelvic floor nice and strong again, so we recommend Kegels, we recommend walking, and then slowly easing into your normal exercise routine of lifting and whatnot. We want to make sure that things are safe, again, that the baby's going home to a safe place, that it's clean, that mom's washing her hands while she takes care of the baby. We do as a safety check, the first thing I think of is these ID bands that we give mom and baby with the exact same number. I think I talked about them already, but as soon as that baby's born, baby's going to get an ID band with a number on it, and then mom and a support person will get that same band with the same number on it. So we we check whenever that baby's going to be removed from the room, we check the numbers to make sure that they're the same, and then when the baby returns to the room, we check the numbers to make sure that the right baby is going to the right mom.
Okay, so one safety measure implemented in postpartum is ID bands for baby, mother, and support person. Yes, true.
We assist with, sorry, I've skipped this one. We assist with self-care measures. We kind of talked about that, but we do want to teach them to avoid any kind of tampons for the first 6 weeks. We really want to keep that area. We don't want to promote infection at all. So they should just be using peri pads. They should be changing those pads often. They should be cleaning with soap in their perineum, but also their nipples. They should be cleaning with soap. And then we talked about sexuality and contraceptions just in the last lecture. Nutrition, we talked about that also. Calories need to go up by 500 calories per day. It's recommended that they have I need to look at this. I have written down 20 grams of protein per day, but that seems really low. I wonder if it's per kilogram. Well, I'll look that
up. Okay, so protein intake should increase by 20 grams a day when breastfeeding.
I'll look that up and talk to you about it in class. Calcium should be increased by 400 milligrams per day. And then they should have lots of extra fluids, at least 2 to 3 liters of fluids a day. And again, assistance with breastfeeding. If we do that, we promote breastfeeding. We help them with positions. We help them with the latch. We help them with breast care and preventing cracked nipples. The American Academy of Pediatrics recommends that all breastfeeding should occur for all full-time infants, that they should have exclusive breastfeeding for the first 6 months of life. And then it can be continued for the first year, and it says and beyond, as long as it's mutually desired by both the mother and the child. So, we have a lot of judgments on moms who breastfeed into 2 years of age, but really it is recommended. It is the best. They're obviously getting other nutrition at that age besides breast milk, but it's not contraindicated by any means. For bottle feeding, the mom has a couple of choices to feed the newborn. The nurse should support that and respect that. The nurse can help talk about what type of formula they want to use. Commercial formulas are based off of cow's milk. There's soy-based formulas, or there's specialized therapeutic formulas for infants with protein allergies. It's just important that the parents know how to prepare formula, and that they know not to keep it. They don't microwave the bottles. They throw it away after they've used it. And then if it's been sitting out for more than an hour, they should discard it.
Okay, the best way to assess if a baby is getting enough intake is by counting how many wet and stool diapers there are each day.
And then these are just more safety during ambulation. So when they get up to walk for the first time, first you should make sure that they have on those mesh underwear and a big pad, because there will probably be a lot of blood that comes out that first time that they stand up. But the first time that we get them to actually walk, we want to check their blood pressure to make sure they don't have any kind of hypotension We're going to have them sit on the side of the bed or just elevate the head of the bed for a few minutes before getting up. We want to make sure they're not dizzy just with sitting up. And then when they go to stand, we're going to stay with the client, stand with her and make sure she feels steady on her feet, especially if she's had any kind of epidural. Make sure she can feel her feet, that she has sensation, that she feels that she can strong. We're going to ambulate alongside her, making sure that she doesn't fall. We're going to ask her how she feels, and we're going to stay close by. If she's in the bathroom for the first time, I'm going to stay in the room, outside the bathroom. Every bathroom in labor and postpartum have a string that they can pull that alarms the emergency call light. And so sometimes it gets pulled by accident, but if they need help, they're going to pull that and everyone will come running to help them. But we're going to stay in the room just in case she still feels lightheaded in the bathroom. We've talked about this, so we're not going to talk about that again. We're going to promote parental roles, really encourage dad in the process, kind of help him have a role. Sometimes they feels like they can't do anything right because mom has to feed the baby and mom has to be present. And there's a lot of focus on mom, but we want to also promote for dad, right? Encourage him how to change a diaper, how to swaddle, how to give a bath. A lot of times it's very helpful if the dad can get up when the baby cries in the middle of the night, change the diaper, bring it to mom, mom can feed, and then dad can burp and mom can go back to sleep, right? Or just whatever it is that the partner has as a role and is involved in the care. We want to teach about postpartum blues, and again, we want to teach the family members too for signs to look for and things to look out for, but we've talked about all of these. And then prepare for teaching. Typically, or for discharge, most of the time, the hospitals will call, do a telephone follow-up to make sure that everything's going okay at home. And then they'll follow up with their doctor for an outpatient visit. Some places, like in Nevada, the health district, they offer, let me see if that's on the slide. Yeah, this nurse family partnership. And this is a really cool program. This is where the family's nurse will come out to families and will support them, do home visits, and kind of help the first time parents succeed. And so it's really kind of cool. They follow them through their pregnancy, and then they follow them the first year after delivery to kind of help and to promote just a healthy, like a transition, and teach them things at home. So it's kind of a really cool program. It's RN, an RN has to go. So if that's a job that you think you might like, it's working with the health district. But then challenges that face families when they're going home would be lack of role models for breastfeeding or infant care, lack of support for the new mom, just that there's maybe that they don't have family close by, that it's non-supportive or overwhelmed, or they have a fatigued partner, feeling of isolation. Having a baby can be very isolating, so there's that. Parents might be overwhelmed, and then there's prenatal classes usually focus on birth, but they don't really focus on the postpartum part of it, right? So some countries have like a postpartum doula, which sounds amazing to kind of help through this process. But lots of things that we can talk to the families about, lots of challenges, and so that's why a program like a nurse family partnership is really helpful for a lot of families who need that extra support and teaching and care during that first year after birth.
Oh my God, we're done. You can go to bed now. Bye.